Thank you for pressing play on the Inside Deschutes County podcast. Wherever you might be and however you might be listening, thank you for making us a small part of your day. You can subscribe on any podcast platform. You can also find us at deschutes.org/podcast.
Deschutes County is an amazing place to live,
Ease of access.
work, and play.
Great place to raise a family.
I love the weather and the high density.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Welcome to the Inside Deschutes County podcast. So glad you're with us. I'm Eric Breon. Well, homelessness is one of the most visible and complex challenges in our community. And few people are closer to that reality than my next guest. Colleen Thomas leads the county's Homeless Outreach Services team, better known as HOST. We're going to refer to HOST a lot. She works on the front lines every day, helping people find stability, support, and a path forward. Colleen, thank you so much for joining us.
Thanks for having me.
It's been a while.
It has.
Haven't seen you around.
Been a little busy.
How are things?
Things are good. Busy, transitioning into the summer months.
That's got to be a busy time of year for you.
Yeah, definitely. I mean, I keep on saying that things will not be as busy, but as we transition, whether it's extreme weather and we're going into smoke and heat extreme weather, so things change, but it's never not busy.
All those things. Yeah, so I want to be mindful of your time. There's lots to talk about. So let's dig in. Let's explain HOST, Homeless Outreach Services Team. Explain a little bit about what that work is.
Yeah, of course. So the Homeless Outreach Services team, we are a specialized mobile treatment team working with folks that have co-occurring disorders that are literally homeless. So we are meeting with folks in the community wherever they are to help support them in a person-centered approach to transition out of their current circumstances.
So what is a typical day for the HOST team? What does that look like? Because I'm sure that can run the gamut. That can be a lot of different things when you're talking about homelessness.
Yeah, as you mentioned in the intro, homelessness is a really complex issue. And so there is no
Just
one...
a little bit. Just a little.
So there's never a one day in the life. Every day looks a little bit different. And that's part of, I think, what brings us continuing to do the work, because we get to be with people in the community. And so our team consists of case managers and peer support specialists that meet here in Bend mainly. We have staff that go then out into Deschutes County to meet with folks wherever they are located. And some of that is, meeting with them, making sure they have access to basic needs, or transporting them to appointments, mental health appointments, or just building rapport in the community. That's kind of our role, to provide that person-centered approach for folks to identify what barriers they're experiencing and help support them in whatever it is that they need in that moment.
That's got to be a big part of it, right? The building rapport part, like building trust with individuals to get them to hear what you're saying. I mean, let alone follow the advice that you're giving, but just to absorb it, hear it, and have the conversation even.
Yeah, that's a huge part of the work, especially when you're working with chronically homeless individuals that may have distrust in systems. They're just trying to survive on a day-to-day basis. And so a lot of the work that we do is building that rapport, getting to know someone on an individual basis, and then just kind of understanding them in really whatever led to where they are today. And every story that we get to encounter, or person we get to encounter, has a different story. So a big part of it is, how do we continue to build that rapport? There's data out there that says that it takes, on average, at least 7 positive interactions with someone that's experiencing unsheltered homelessness to be able to trust and make transition into like an effective case management role.
That's a lot.
Yeah.
I mean, to get into breaking that, for lack of breaking that seal, breaking the red tape, if you will. Bad analogy, but I mean, in terms of kind of knocking down the doors, knocking down the walls that because they've experienced trauma, they've experienced maybe the system has failed them in some rhyme or fashion. Seven
Yeah.
times.
Yeah, so consistency is a huge portion of what we do, is making sure that we are coming in with no agenda when we meet with folks. Again, we are a specialized treatment team, so we're really focusing on working with folks that have co-occurring disorders, so acute psychiatric disorders that are literally homeless. So we come in, we meet with them right off the bat. We're just trying to get to do screenings in the field, and there's a lot of nuance that comes with that too. And so having trained staff that know how to do that and work with folks, again, coming at it not with an agenda, but to really better understand a person, and that takes time. And so I have a story of someone I worked with in Redmond in East Antler. I worked with that individual for 7 years before he and his significant other
7
were
years.
7 years of
Not 7 times.
no 7 years, and that was
Wow.
consistency to make sure that I could. He was testing me as much as I was trying to understand him a little bit better. And it took that time and that rapport and continuing to show up for him to finally reduce those barriers, let down that guard, and say, you know what, I'm ready to make a change. And now he's been successfully housed for the last 6 years with him and his wife, and rebuilt relationships, got connected with treatment programs. We got him on Social Security benefits, and just ran into him recently, and he's having family come stay with him for the first time in many years.
That's
So
awesome.
yeah, so we do have those success stories, but it takes time, and that's one of the things I think people don't necessarily understand. It's not a magic wand that just overnight something's going to change for someone. There is chronic history. There's, like you mentioned, trauma, complexities that have led people to where they are, and that just doesn't change overnight.
I can't get over the fact, Colleen, that how hard this work is. I mean, because and how emotional it must be for you and your team, not to mention the individuals you're talking to and what they've endured, what they're overcoming to try to get to a better place. This has got to be rewarding, but draining. Like, how do you manage those emotions?
Yeah, that's a great question. And I think for us, it is draining. It is hard. I mean, we do this work because we care. And it's sometimes showing up day after day can be really draining, especially in our current, climate with different camp closures and displacements. But what keeps us coming to the table and coming out and doing the work is the people, and they are resilient. And so the hope that we see in the folks that we serve gives us hope that we can, continue to make those little successes, whether it's holding onto a cell phone for a week or then transitioning into permanent supportive housing. I mean, those are all wonderful little successes, and it's because of the people that we get to serve every day that give us the hope that we can keep moving and keep, helping folks that we can.
Otherwise, it's Groundhog Day, right?
Yeah.
I mean, how do you go into doing this job and not feel like it's that? Because it just kind of it feels like, and I'm no expert, but it just feels like the same things come around again. And trying to measure what that success looks like for you and your team. What does that feel like? Explain that a little bit.
Yeah, I mean, we go through stages of change with folks, and we can maybe take 2 steps forward with, one client individually, and then take, 3 steps back. Whether that's, something that happened self-inflicted by the individual we're working with, or systemic issues that come up that we don't have control over. And so I think for us and the team, and as a supervisor of this small knit team, is I really try to focus on, we lean on one another, and I keep on showing up to do the work because the people that I work alongside, and know that there's passion there, and that we wouldn't show up if we didn't think that there could be successes. And so we change our mission and our approach, every little while when we get to that place of like, oh, we're banging our head against a wall. But what we can do is, rely on the people that we're working with to then showcase to them that they're making success, and they're our teachers as well. And so I think if we try to highlight those little successes and hold on to those, and lean on one another, and take time to just reflect and realize that we can't control what's going on outside of us. My coined phrase to my team is capacity of control. I can't control what the public thinks or what decisions are being made. I can't control what the clients that we serve, the choices that they make do, but what we can control is how we respond and how we can work together and move forward. And that, I mean, it's something little, but it does help us continue to be able to continue showing up every day.
I'm going to steal some of that from my own work. Control what you can control, right? I mean, that's kind of that's tough to do sometimes.
Yeah, especially when you're working with humans,
Yeah.
right?
Yeah, humans,
Yeah.
opinions and all those things. I mean, you talked about your team. They just must be outstanding individuals and strong individuals in order to do this work. Talk about your team a little bit more.
Yeah, I couldn't be more proud of the team that we have. As I mentioned, we have peer support specialists that come to work with lived experience of their own lives that they use to work with clients. And we have really dedicated case managers that have also been doing this work for a really long time. They wear their hearts on their sleeves at times, and they just continue to show up, show their compassion, and they're dedicated to this work. And I think that's what makes, working in homeless services takes a special person because can be political, it can be complex. We're not having those little success stories. We're in it for the long run. We call it the long game, and it's not the short-term intervention. It's showing up, getting to know people, and leaning on one another. Not everybody understands the work that we do, but our team, you can show up and not have to say anything, and everybody gets it. And it's a beautiful thing.
That's pretty cool. I would cry every day.
I do.
I mean, I would think that, tears of joy for the success stories, and then tears of, kind of the stories that you're hearing and the struggles and the roadblocks and, trying to break down the barriers and those walls. I'd be bawling my eyes out every single day.
Yeah, and I think there are a lot
of
of tears.
tissues, a lot of tissue in the office.
Yeah, a lot of tissues, a lot of, maybe dark humor to get through the days.
Whatever it takes.
Whatever it takes. Yeah. And again, my team is really what keeps me going every day. I get to show up and work along some really dedicated and amazing people. You
mentioned closures, and there's been a couple recently. There's the one out at China Hat and out at Juniper Ridge. Talk about how you navigated what the role of host was in those circumstances. I know you're not out there, putting up closed signs, but you are helping people through the relocation process. Yeah, so the Cabin Butte China Hat closure, we had a lot of time leading up to when that closure came. And so our team is, we aren't there to enforce the closures or to relay any messages of whatever, public land agency is doing a closure. We're there to support the people that we work with. So we'll continue to show up and support them and figuring out what that transition plan is for and prepare them for when the closure does happen. So, we were lucky enough, there was a couple of different things that happened leading up to the Cabin Butte closure. We had some additional shelter beds and some housing programs, and we were able to help support folks in transitioning out of their encampments to those resources, which was great. And so sometimes when these closures happen, I say there's one of two things that will happen. It's either the catalyst for someone to make a change and say, yep, I'm ready to make that change. You've been talking to me about getting into shelter or housing with this closure impending, I'm ready. Or the opposite, where that rapport that we were talking about that we built for so long is then diminished and people are in crisis mode. And so they're not willing or ready or able to work with us on continuing those forward motions. And so then we lose touch with people. But our team, no matter what closure happens or impacts happen, will continue to show up and support the clients that we've been working with ongoing. I've heard you say before, this is kind of like, they're encampments, but they're also small communities. Mm-hmm. And when those are, for whatever reason, go away, a lot of dynamics there. So talk a little bit about kind of the effect on the people that now, I mean, now they don't have maybe their neighbor or their support, and now you're trying to give them what they're now missing.
Yeah, that's a huge part of it. When we have these larger encampments like China Hat / Cabin Butte or Juniper Ridge, these are folks that have built community. These are folks that have lived in those areas for years, if not decades in some locations. And so the folks that we serve and that we work with in these community, they have built community. The person that's, down the road past the squid tree is, their neighbor that they can call on if they need a ride or they need somebody to watch their dog. I reference it a lot to, poverty. When we think about poverty in our community and what it has looked like historically to what it looks like today, we don't necessarily have the mobile home parks that we used to. We have these larger encampments. And so the folks living in those areas have built community because that's one of the main drivers of human nature is to build community. And so, of course, the folks that are living in these larger encampments, they create community. They have neighbors. They are our neighbors, whether unhoused or housed. And so when those areas are disrupted and closed and people are relocated, they lose that sense of community. And for us and our team on Host is how do we continue to support them in building community and not losing touch? We don't want to lose touch with our clients. We want to ensure that they have continuity of care, and that is a huge barrier for us when there are these bigger camp closures. So consistency and continuing to show up, whether the closure is happening in 6 months or in 2 weeks. We want to make sure that we can really have some resemblance of community for folks as they're disrupted in their living environments.
Yeah, important stuff there. You mentioned it's summertime,
Mm-hmm.
and with summer comes wildfire season and the dangers of that with people living outdoors. Um, how does your team help prepare people who are homeless or living without a home, um, a house? How do you manage that situation when it comes to preparing for the dangers of summer? Of course, there's dangers in winter, but we're smack dab in wildfire season, and we saw some fires last year that were near encampments. So,
Yeah.
what kind of services, what kind of outreach do you do for that?
Yeah, that's a really big part of the work that we do leading up to these warmer months and summer months, and vice versa for the cold as well, but a little bit different. But right now, Deschutes County Public Health has a great emergency preparedness team that creates some materials with educational materials on fire safety, how like heat exposure. So we are utilizing those tools given to us by the emergency preparedness team to bring those out to the folks that we work with, provide some education. We're not just handing out a pamphlet and saying, here you go. We're really walking through those pamphlets step by step to ensure that the folks we're working with really understand and are aware of the dangers that they are faced with, because they are isolated. They are, right in the woods, right? We talk about wildfires. So we ensure that we partner with some of our local fire departments and the sheriff's office and Deschutes County Property Management to distribute fire extinguishers to folks, ensure they have, backup water even for small fires, and that they are connected with something that we might take for granted is like cell phones with emergency preparedness. Making sure that folks are signed up for those so that they have alerts as well. So that they can be prepared when and if there is a wildfire risk.
I'm sure the collaboration part is massive.
Yeah.
When it comes to either this time of year, but in general, in terms of, finding housing, shelter beds, cooling centers, all the water,
Mm-hmm.
all the basic needs that people talk about that they might need. Talk about the collaboration part of this.
Yeah.
It's got to be huge.
Yeah, we wouldn't be able to do our work without our partners. There's a lot of amazing community-based organizations that we work alongside. I have really prided myself and my team on our relationship with our law enforcement partners. And we wouldn't be able to do the work alone. And so a big part of that, again, we are a specialized treatment team working with a small subset of the population of folks experiencing homelessness. But that doesn't mean that we aren't encountering somebody that may not want to work with us or may not meet our program criteria. So there's often a lot of warm handoffs. One of the things that I think is wonderful about Central Oregon is the collaboration across partners with community-based organizations. And as we've grown our shelter network, relying on the relationships to really connect the folks we're working with to available resources is vital. So, I feel super lucky that we have that ability and opportunity here in Central Oregon.
You've been a strong advocate for permanent supportive housing.
Yep, it's what I said is the bread and butter to addressing chronic homelessness.
How? Give me an example of that and how it works.
Yeah, so permanent supportive housing is providing someone housing without really any strings attached, right? There's more nuance to it, but permanent supportive housing is giving somebody an opportunity to have a safe place to live where they can address some of their chronic medical conditions, mental health conditions, really get that stability so that they can then work through their continuum to address the other barriers they may be, experiencing. A lot of permanent supportive housing programs have specialized priorities of folks that they'll serve. We, luckily, in our region recently, Cleveland Commons Permanent Supportive Housing Project opened up, providing 34 units of permanent supportive housing. And we were lucky enough, from that opening, we've had 9 folks transition into that program that have been chronically homeless throughout Deschutes County. And just to be able to give them the dignity of having a safe place to be is monumental. Now we can really dive into how do we address some of those other barriers that led them to where they were before transitioning into housing.
Host has probably evolved so much. How many years have you been in Deschutes County?
Going on 12 years.
12 years. Okay, so take me back.
Yeah.
12 years. Hit the rewind button. Colleen 12 years ago.
Yep.
Colleen now. What have you kind of I know that's a big time, but maybe some of the general principles as to like how this has evolved for you and the growth of the program, the growth of the need, all those things, and just not just that, but how it's impacted you personally as well.
Yeah, when I look back, so when I first started in this role, it was just me providing direct street outreach to folks across Deschutes
Just
County.
you.
Just me. And now I have a team of 7 individuals supporting folks across Deschutes County, which is just so remarkable to look back and think. But also, over time, the complexity of the people we serve has grown as well. Like we are seeing folks that are more chronically homeless, have, chronic health conditions. We throw a global pandemic in the midst of that time. So a lot of, not only has the need grown, but the services have grown as well. When I first started, the only tool in my tool belt is as I like to refer to it, was the Bethlehem Inn. Was the only shelter program. Shepherd's House Ministries was also getting their footing, but it was still a small program. And so now we have these other resources of other shelter programs, safe parking, micro shelters, like all these amazing opportunities so that when we are interacting with somebody, we have those tools in our tool belt to say, hey, I have options for you, which is great. But that's not to say that the complexity and the need hasn't gone down. The need has grown. People have lost housing. Is here in Central Oregon, the housing market has skyrocketed, so people have lost homes. So when I think back over 12 years, it's not a fluid, journey. A lot has happened. A lot has changed. I referenced one story at the beginning of a gentleman I worked with for 7 years, and I think when I think of my role in this and how the privilege that I've had to walk alongside some folks that have really struggled in our community and to see them succeed, even though it's taken time, is like so monumental for me personally. As I've grown my family, as I have built my roots here in Central Oregon, I feel connected to the growth that we've seen, both good and bad. I'm proud to work for Deschutes County and to be able to just really be able to see and have like a team now. Like I get to show up and work with folks. It's rare that I get to show up and say to someone, "Oh yeah, remember when we started back in 2014 or whenever whenever it was." So again, I think
Well, it's helpful when you have somebody walking alongside you
yeah,
with the same goal in mind.
hmm
Like, hey, we want to get people help
yeah,
that need it.
yeah.
And now I'm not doing it alone.
Right. And that I think has been really huge for me in continuing to do this work is that I've been able to build a team of dedicated individuals that are really passionate about this work and have a drive to do this work. They teach me. I'm not out in the field as much as I used to be. But I have this staff that gets to go and have the privilege to meet our neighbors and then bring me out and get me. My staff say to me, "Colleen, you're getting a little crunchy around the edges. Why don't you come out into the field with us?" And and I think that's a beautiful thing.
Get out of the office, Colleen. Quit looking at the spreadsheets.
Yes.
Well, spreadsheets are interesting to me because a lot of like, what are the measurements of success? Because the numbers must look like a stock market graph, ups and downs and the roller coaster ride of tackling this project. So when you're sitting in your meetings and you're poring over the stats and you're looking at the information and the data, what is success? That must be hard to measure.
Yeah, success, especially
Not to put you on the spot, but I mean, I think
they want to know.
people kind of want to know, inquiring minds, right?
Yeah, and I think it's hard to define success with this population. For us, working with folks again that have acute psychiatric disorders that are chronically homeless, if we can get someone to show up for a medical appointment and follow through and sit in a medical office for 40 minutes, that's a huge success for us. I think a lot of people looked at, well, how many people are exiting homelessness? How many people have transitioned into housing? And yes, we do have those successes, but sometimes they're few and far between. And when you look at something like the local point in time count data, which a lot of people reference to when you talk about homelessness, they see the increase. And so some people may feel like there aren't successes happening, but for my team, the host team, we really have to scale it down to what are those little successes? How do we, if people keep showing up and they're not slamming, the door in our face or yelling at us, like that is a success. So sometimes we have to change our approach. Sometimes we have to kind of look more at the data of, how many people are transitioning or, one of the things I think Deschutes County Health Services and other agencies are looking at are the social determinants of health. Can we use those to identify success? So what I think of as success is my staff keep showing up and the people that we work with are trusting us and we're building relationship.
Is that what gives you hope in this job? Because that must be one of the hardest things, I mean, because sometimes it can just probably feel overwhelming. And, you it kind of goes back to the Groundhog Day that we talked about. But what gives you hope in this work? And maybe specifically in Central Oregon, is it the collaboration? I know the cities and counties and are working together, and there are steps being made. You've shared success stories. Is that what gives you the most hope?
Yeah, I think that it's hard to delineate hope on some days, but the hope is the collaboration. The hope is that we're growing. Like I said, we only had 2 shelter programs, when I first started this work to now how many we do have, and more community-based organizations, and that there are dedicated people that continue to show up that want to do this work. And again, not to brag about my team more, but that they keep
Do it. Just brag about them.
They
It's a
keep
county podcast.
they keep showing up and they have smiles on their faces and they say that they love their job. And on the days that they don't love their job, they're coming and they feel safe to have that conversation. The transparency is there. And, I think that there is hope on the horizon as we think about what are some of those long-term solutions to address homelessness, like a permanent supportive housing program. We have our first one in Central Oregon, and it's going great. And if we can have those opportunities to go and sit with somebody in their new apartment and share, a cup of coffee, that's hope, right? And then seeing some of our clients that want to start to learn about how do they become a peer support specialist, because the person that helped guide them and walk that journey with them over however many years to get them where they are today, that's hopeful. People with that lived experience that want to help people, and that dignity that we can give someone in having a conversation, those are the moments that give me hope.
Hope and a lot of pride, I'm sure,
Yeah,
for the work that you've done and the work that your team is doing.
Yeah, there is a lot of pride. This is not easy work, and we live in a really complex community. And the solutions don't look like something in these bigger cities. So when we have this collaborative approach from, a county like Deschutes County, with community-based organizations, municipalities, and even lived experience agencies as well, when we can all come together and sit in a room and talk about where we started and where we are now and what is the future on the horizon, that's hopeful, because people are dedicated. And I think that there's always going to be more work to come, but I think that it can be done, and that the people are at the table that can make those decisions, and helping them to understand that these are our neighbors, and having that conversation. We're not going to change the minds of everybody. Capacity of control, and if we can control how we respond and continue to show up, that's pretty meaningful.
That would be a good stopping point for this podcast because you ended it so great. I want to sneak in one more
Yeah.
question, though. And for those listening who, might want to help in some rhyme or fashion, what can the public do to assist? I mean, it seems like, an unsurmountable task. And so, but I know that people want to help. And I've heard people, hey, can we distribute waters? Can we do things? What can people do if they want to help? Not necessarily with the in-depth outreach, but maybe just the simple things. Are there things that you need help with?
Yeah, when I'm asked that question, the first thing I always goes to the first thing in my mind is educate yourself. Educate yourself on what resources are available, what is happening, what are some of the decision points that, with legislation, what's happening locally, and then volunteer. I think we have some amazing organizations in our community that are always looking for volunteers. I think leaning into the discomfort for some of the folks that may not be as familiar or aware of this population, and to really, at the end of the day, understand that these are our neighbors and that everyone deserves to be treated with dignity or respect, rather, whether somebody has four walls, a roof, and running water, or living unsheltered in a tent. A lot of the people that we work with, across Deschutes County, they are some of our baristas, the folks that are pumping our gas, a lot of college students living in their cars. They're part of our community. And so if we can lead with that curiosity, to educate ourselves, to volunteer, lean into the discomfort if that is a place where you're coming from, and then lead with some compassion. I think that those are all ways that help the community opposition change for the better. So yeah, volunteer, donate, and then just lead with dignity and respect.
And bring tissues.
Bring tissues.
Lots of tissues. Because there's joy in this work.
Yeah.
And there's, you're making progress. And so yes, there's the battles, but yes, there's also the success stories too.
Yeah, and know that the people that are doing this work are doing it out of a place of dedication, compassion, and a real sense of love for our neighbors.
Lots of insight on a complex topic. Thank you for your openness, for your candor, and your willingness to do this work. Colleen Thomas with HOST, the supervisor of HOST at Deschutes County Behavioral Health. Thank you so much for joining us.
Thanks, Eric. It's great to be here.
If you want to learn more details about the homeless service continuum in Central Oregon, you can go to the website cohomeless.org. You can find the point in time count data, opportunities to help, lots of information there. That's cohomeless.org. Be sure to catch Inside Deschutes County wherever you listen to your podcasts. You can find us on Apple, Spotify, Amazon Music, and online at deschutes.org/podcast. We hope you click those subscribe and download buttons. But until next time, we hope you're safe out there.